Hey there, how's everyone doing today?
Hi. Yeah, we hope you're feeling good. Nina, how are you today?
I'm good, thanks. A little tired, maybe. You?
Same. I was thinking, have you ever been nervous to talk to a doctor?
Oh my gosh, yes, especially in English. Like, what if I say something wrong?
Exactly. And that's actually what we want to help you with today.
Right. We're going to practice hospital conversations. Real, simple English that you can actually use.
This is not from a textbook. This is the English people really say when they visit a doctor.
And you know what? Making mistakes is totally normal. We all do it.
Yeah, so don't worry. Just listen, practice, and if you like this kind of helpful content, maybe hit subscribe.
No pressure, though. Just stay with us and let's learn together.
So, Nina, when was the last time you went to see a doctor?
Maybe 2 months ago, I had a bad cough and I didn't know how to explain it.
Ooh, no. What did you say?
I tried to say I have cough, but I think I should have said I have a cough.
Right. People usually forget the It's a small mistake, but it happens all the time.
Yeah, and then the doctor asked me, how long have you had it? And I was like, 3 days? 4 days?
See, that's real life. You were trying to remember.
Exactly. In daily life, we don't always speak perfectly.
True. And doctors understand that. They just want to help you.
Right. So today we're going to practice those simple sentences you need at the hospital or doctor's office.
Yeah, like how to explain what's wrong, how to answer questions, and how to ask for help.
And we'll keep it simple, A2 to B1 level. Nothing complicated.
Okay, so let's start from the beginning. When you arrive at the hospital, what's the first thing you say?
I think you say, I have an appointment.
Yes, that's perfect. I have an appointment with Dr. Smith.
Or if you don't have an appointment, you can say, I need to see a doctor.
Exactly. For example, last year I went to the emergency room and I said, I need to see a doctor. I hurt my ankle.
Oh no, what happened?
I was playing football with friends and I fell. It was so embarrassing.
But you explained it clearly, right?
Yeah, the nurse asked what happened and I said, I fell while playing football.
That's good. Simple and clear. What about when the receptionist asks for your information?
Oh, they usually say, can I have your name, please?
Right, and you just say your full name clearly.
Yeah, for example, my name is Nero Martinez.
And sometimes they ask, date of birth?
Yes, don't say birthday. Say date of birth or just answer with the date.
Like March 15th, 1995.
Perfect. And if they ask for your phone number, just say it slowly.
Yeah, like my number is 555-1234.
Exactly. Slow and clear is always better.
Okay, now the important part. You're sitting with the doctor. What do you say first?
The doctor usually asks, what brings you in today?
What brings you in today? That's a common question, right?
Yeah, and you can start with, I've been feeling, or I have a...
Like, I've been feeling sick?
Yes, or I have a headache.
What if you don't know the exact word, like your stomach hurts?
Just say, my stomach hurts. Simple as that.
Oh, so you can just say, my hurts?
Exactly. My head hurts, my back hurts, my throat hurts.
That's so useful. For example, if I twisted my wrist, I could say, my wrist hurts.
Perfect. And if you want to be more specific, you can say, I hurt my wrist. What about when you have a cold or flu? How do you explain that?
I think you say, I have a cold.
Yes, or I have the flu.
What's the difference between a cold and the flu?
A cold is lighter. You have a runny nose, maybe a small cough. The flu is stronger. Fever, body aches.
Oh, I see. So if I just have a stuffy nose, I say, I have a cold.
Exactly. For example, last winter I called my doctor and said, I think I have a cold. I have a runny nose and a sore throat.
A sore throat. That's when your throat hurts, right?
Yes, sore means it hurts or feels uncomfortable.
So I can say I have a sore arm if my arm hurts?
Not really. We usually say sore for throat, muscles, or after exercise. For arms or legs, just say my arm hurts.
Ah, okay. English is tricky sometimes. What if the doctor asks, how long have you felt this way?
Good question. You need to say how many days or weeks.
Like, for 3 days?
Yes, I've had this pain for 3 days.
Or since Monday?
Exactly. I've felt sick since Monday.
What's the difference between for and since?
For is about the length of time. For 3 days, for 2 weeks.
And since is about the starting point.
Yes, since Monday, since last week, since yesterday.
Oh, that makes sense. For example, I've had a headache since this morning.
Perfect. That's exactly right. What about when the doctor asks about your symptoms?
Symptoms are like the signs that you're sick, right?
Exactly. Fever, cough, pain, those are symptoms.
So if the doctor asks, what are your symptoms? I can say, I have a fever and a cough.
Yes, and you can add more details, like I have a high fever.
Or I have a dry cough.
Perfect. A dry cough is when you cough but nothing comes out.
And a wet cough is the opposite?
We usually say chesty cough or just cough with phlegm.
Phlegm. That's the stuff in your throat when you're sick.
Yeah, exactly. But in simple English, you can just say, I'm coughing up stuff.
That's so much easier. What if you need to describe pain? Like, is it strong or weak?
Good point. Doctors often ask, on a scale of 1 to 10, how bad is the pain?
Oh, I've heard that before. So 1 is very light and 10 is terrible.
Exactly. For example, when I hurt my ankle, the doctor asked, and I said maybe a 7.
That's pretty bad.
Yeah, it hurt a lot.
You can also describe the type of pain, right?
Yes. You can say it's a sharp pain or it's a dull ache.
What's the difference?
Sharp pain is sudden and strong like a knife. A dull ache is constant but not too strong.
Oh, so if my head hurts all day but it's not terrible, I can say, I have a dull headache.
Exactly. And if it's sudden and strong, I have a sharp pain in my chest. What about when the doctor wants to examine you?
Oh, they usually say, let me take a look, or I need to check.
Right. They might say, I need to check your throat, or let me listen to your lungs.
And you just say, okay.
Yeah, or sure. Simple as that.
What if they ask you to do something, like open your mouth?
They'll say, open your mouth, please, or take a deep breath.
And you just follow the instructions.
Exactly. For example, my doctor once said, roll up your sleeve, and I didn't understand at first.
Oh no, what does that mean?
It means push your sleeve up your arm, so they can check your blood pressure or give you a shot.
Ah, that's useful to know. Okay, let's practice. Imagine you have a headache. What do you say to the doctor?
I have a headache.
Good. Now add how long you've had it.
I've had a headache for 2 days.
Perfect. Now you try at home. Think about the last time you felt sick. How would you explain it in English?
For example, you can say, I had a stomach ache yesterday and I felt really tired.
Yeah, practice saying it out loud. It helps your brain remember.
What about when the doctor gives you advice or medicine?
Oh, they usually say, I'm going to prescribe, or you should take.
Right. For example, I'm going to prescribe some antibiotics.
Antibiotics. That's medicine for infections, right?
Yes, exactly. And they'll tell you how to take it.
Like, take this twice a day.
Yes, take 1 pill twice a day with food.
With food means you eat something first.
Yeah, so the medicine doesn't hurt your stomach.
That's important to know. For example, if I forget and take it on an empty stomach, I might feel sick.
Exactly. So always listen carefully to the instructions.
What if you don't understand something the doctor says?
Just ask. You can say, "Can you repeat that, please?"
Or, I didn't understand. Can you explain?
Yes, doctors are used to this. They won't be annoyed.
Right. For example, if the doctor uses a big medical word, I can say, sorry, what does that mean?
Perfect. And they'll explain it in simpler words. What about when you're leaving? What do you say?
I think you just say, thank you, doctor.
Yeah, that's perfect. Simple and polite.
And if you need another appointment, you can ask, when should I come back?
Yes. Or the doctor might say, "Come back in 1 week," or "Call me if it gets worse."
If it gets worse, that means if the problem becomes bigger.
Exactly. For example, my doctor once said, "Take this medicine and call me if it gets worse."
That's good to know. So you don't have to come back unless there's a problem. What if you need to call the hospital to make an appointment?
Oh, that's a bit scary sometimes.
I know, right? But it's actually pretty simple. You just say, I'd like to make an appointment.
Yes, and they'll ask, "What's the reason for your visit?"
You can say, I have a cough, or I need a checkup.
A checkup is when you just want the doctor to make sure you're healthy, right?
Exactly, like an annual checkup or a routine visit.
For example, I called last month and said, "I'd like to schedule my annual checkup."
And they probably asked, when would you like to come in?
Yes, and I said, "Do you have anything available next week?"
Available. That means free time?
Yeah, when the doctor is free to see you.
What about emergencies, like if something is really serious?
Then you go to the emergency room or you call emergency services.
And you say, this is an emergency.
Yes, or "I need help immediately."
What if you're calling for someone else, like your friend or family member?
You can say, "My friend needs help," or "My mom is having chest pain."
That's so important. For example, if my sister fell and couldn't move, I would call and say, my sister fell and can't get up. We need an ambulance.
Exactly. Be clear and calm. The person on the phone will help you. You know what else is useful? Knowing how to talk about allergies.
Oh yes, doctors always ask about that.
They usually say, "Do you have any allergies?"
And you can say, I'm allergic to penicillin, or I'm allergic to peanuts.
Right. "I'm allergic to" is the key phrase.
What if you're not sure if it's an allergy?
You can say, "I think I might be allergic to," or "I had a bad reaction to."
For example, I had a bad reaction to that medicine last time.
Perfect. The doctor needs to know that.
What about when you're at the pharmacy picking up medicine?
Oh, the pharmacist usually asks, "Do you have any questions about this medication?"
And you can ask, how many times a day should I take it?
Or, "Can I take this with other medicines?"
Yeah, for example, I once asked, can I drink coffee while taking this?
That's a good question. Coffee can affect some medicines.
Right, so it's always good to ask.
What if you need to cancel or reschedule an appointment?
Just call and say, I need to cancel my appointment, or can I reschedule?
Yeah, they'll ask when you want to come instead.
And you say, is next Tuesday available? Or do you have any openings this week?
Openings means available time slots.
For example, last month I called and said, I'm sorry, but I need to reschedule. Do you have any openings on Friday?
And they probably moved it for you.
Yeah, no problem. Okay, let's do one more practice. Imagine you're calling to make an appointment. What do you say?
Hi, I'd like to make an appointment with Dr. Lee.
Good. And they ask, what's the reason for your visit?
I have a sore throat and a fever.
Perfect. Now you try. Think about what you would say if you needed to see a doctor this week.
Practice out loud. For example, I'd like to make an appointment. I've been having back pain for 5 days.
Yeah, the more you practice, the easier it gets.
You know, Naina, I think the most important thing is to not be afraid to ask questions.
Absolutely. Doctors are there to help you. They want you to understand.
Right. If you don't understand something, just say, "Can you explain that again?" Or, "What does that mean?"
Yeah, your health is too important to stay confused.
Exactly. And remember, simple English is enough. You don't need perfect grammar.
Just be clear and honest about how you feel. So, what did you learn today?
I hope you learned some useful phrases for talking to doctors and visiting hospitals.
Yeah, simple, real English that you can actually use.
Try this challenge. Think about the last time you felt sick. How would you explain it to a doctor in English?
Write it in the comments. For example, I had a headache for 2 days and felt really tired.
We'd love to see your sentences. And if you found this helpful, share it with someone who's learning English.
And don't forget to subscribe if you want more practical English lessons like this.
Remember, it's okay to make mistakes. Just keep practicing.
Take care of yourself.
See you next time.
Bye.
Goodbye.